Excellent. Thank you so much. So again, my name is Alyssa O'Neill, and I am an occupational therapist with Bierman Autism Centers. First of all, I want to thank you all for your time tonight. I'm so excited you're here to join us to learn a little bit about OT. So my home center is in Warwick, Rhode Island, but I also provide services in our East Bay and Cranston, Rhode Island locations. I have been with Bierman for almost 2 years now, and I have absolutely loved building my career here. It has been the absolute best place to learn to grow. Prior to starting with Bierman, I graduated from Syracuse University with my bachelor's degree in health and exercise science, and I received my master's of occupational therapy from Bay Path University in Massachusetts. I am incredibly passionate about my field, and I love talking about what I do to anyone who will listen. So I'm thrilled that I have people here who want to hear about it. But admittedly, the concept of what occupational therapy actually is a little ambiguous, even to experts within the healthcare field. I mean, for some context, in graduate school, I took an entire semester-long course on what OT actually is. And even then, it wasn't until I actually started working in my field that I truly understood what it is that OTs do. So today you're going to kind of get the condensed crash course on all the highlights. There's going to be some information that I could spend all day talking about, and there's a lot in here, but I'll do my best to reel it in and kind of keep it short and sweet. So if you have questions as we go, feel free to pop them into the chat. But there will also be some time at the end so I can clarify anything that's unclear or that you want to know a little more about. So my assumption is that if you're tuning in here tonight, you have at least some degree of curiosity as to what OT is and how practitioners like myself do what we do. So that is exactly what we'll dive into. And if that's not why you're here, then buckle up because you're coming along for the ride anyway. To get started, I will give you a little brief introduction on OT's history. I won't get too far into it, and I won't bore you with the nitty-gritty details, but this background really is very helpful for understanding the basics of the field. Occupational therapy was formally established as a healthcare profession in the year 1917, spearheaded by a woman named Eleanor Clark Slagle, who is that woman there on the left. She began her career as a social worker in an adult mental health setting. During her time as a social worker, Slagle and some of her colleagues had begun to notice how involving patients in their care in meaningful activities like arts and crafts and daily chores had a really positive impact on their overall level of function and their mental state. So she founded a formal education program for this new field that she called occupational therapy in about the year 1915. And then it really took off during World War I. So soldiers were returning home from war, and they either had significant mental health struggles or they had life-altering physical injuries. Either way, life looked very different for them post-war than it did before they left. So the early OTs found ways to help integrate these soldiers back into daily life in society by keeping their hands and their minds active through things like leather work and sewing and other crafts. Occupational therapists were able to help these soldiers to recover and reintegrate into society in both body and mind. Through its establishment and development, OTs have built this whole profession on the concept that every person deserves to live a life that is meaningful and fulfilling. This concept has been the foundation for an over 100-year-long legacy that has brought OT as a field to where it is today. So to really understand occupational therapy as a field, we first need to understand what an occupation is. Contrary to what some people may believe, an occupation is not just what you do for work, and OTs are not the same thing as career counselors. Believe it or not, I've actually had people ask me if that's what I do for work, and it is not, although that would be cool. It's not my job. An occupation is simply any functional everyday activity that we either want or need to do in our lives. This can be quite literally anything from brushing your teeth to going to work or school, playing guitar, sleeping. Simply put, if it occupies your time and it's important to you in some way, shape, or form, it's an occupation, and an OT can help with it. To really illustrate this, I'll kind of give you my little elevator speech to kind of drive it home. So first, think of every single thing you do in a day, from the minute you wake up until the minute you go to sleep. So, and then even while you're sleeping too. Some of those things you have to do, like eating, bathing, dressing yourself, basically keeping yourself alive on a very, very basic level. Some of these things you want to do, like reading a book, playing cards, playing an instrument, etc. And some of those things fall somewhere in between, like caring for kids and pets, managing your finances, etc. The job of an occupational therapist is to help our clients and their families determine where they need support in their daily lives and to help them be as functional and independent as possible within those areas. We can help our clients gain skills they've never had before, regain skills they've lost or have been unable to achieve, and provide lots of adaptations and education in order to teach our clients how to live their most independent, functional, meaningful lives, whatever that looks like for them. I also sometimes call OT the profession of life hacks because I feel like I'm constantly finding little ways to modify what people are doing and how they're doing it to make it work better for them. OTs have an extensive background in biology, anatomy, psychology, neurology, those kinds of fields, in order to create and practice meaningful, impactful change from a scientific place. We then take that scientific background and design interventions that are more palatable for our clients. At Bierman specifically, we as OTs focus on a variety of occupations for our kiddos, depending on what their unique needs are. For children, though, the most important and impactful occupation we target is play. Children learn so much about themselves, others, and the world around them through the context of play. Mr. Rogers really said it best when he said, play gives children a chance to practice what they're learning. So they're taking in everything from the environment, and you'll notice them embedding things here and there within their play. So here at Bierman, if there is some skill that I can target within the context of play during my OT sessions, I will do that as often as I can. But we also work on things like social participation, age-appropriate self-care, and like higher level self-care skills like money management and meal preparation. I'll work on things like school readiness skills, leisure and personal interests, and sleep. We target our occupational therapy services to each child based on their needs that we determine through collaboration with families and an in-person assessment we do. And no two sessions look alike. I could work with 8 different kids in a day, and our sessions will not even remotely resemble one another. The really cool thing about what I do is that I can truly focus my therapy on the needs of the child that I'm working with in that moment and their support systems within the context of the environment that they're in. And before I move on, yes, that is a photo of me giving a piggyback ride to a kiddo while I'm wearing a mommy shark onesie. The fact that my kiddo's #1 occupation is play means that it's mine too by association. So I definitely spend all of my day playing, and it is fine by me. As an occupational therapist, as I kind of mentioned before, my job is not only to understand my clients' skills and abilities, but also the contexts in which they perform those skills. In OT, context is a term used to describe the different environmental and personal factors that are specific for each client. These contexts influence how a client develops skills, how they develop routines and habits, how they identify their roles, what their roles even are, and then how they identify and define satisfaction in their own daily lives. There are 6 major categories for context: cultural, personal, physical, social, temporal or time-related, and virtual. It's important for me to consider things like where a task is taking place, family structures and routines, cultural traditions and influences, things like the time of day I'm working with a client, if I've gotten them before lunch or after a nap, or even their inherent personalities will dictate how I work with a kid. In order to provide the best therapy for my clients, I really try to spend time understanding those contexts that make them who they are. In doing this, I can better understand not only why a certain skill or behavior may or may not be occurring, but I can better tailor myself to suit their needs and support them. In the OT world, we refer to this idea as therapeutic use of self. My ability to relate and connect to my clients is my greatest therapy tool, more important than fancy equipment or any expensive training course. I truly do my best to see my clients for exactly who they are and meet them where they're at to build meaningful connections to support their growth. And judging by the number of children who try to break down my therapy room door on a daily basis and follow me down the halls, I would say it's probably working. So in order to complete any of these daily activities, we actually have to have and consider many smaller skills called component or performance skills in order to complete them. There are lots of phrases that OTs will use in order to kind of categorize and describe all of these skills that we target when we work with our clients. You might have heard the terms fine motor skills and gross motor skills before. Gross motor skills pertain to movements involving large muscles or large muscle movements themselves, such as independent walking or running or climbing, etc. Fine motor skills are a little different, and they involve the use of smaller muscles or muscle groups like grasping, coloring, pinching, etc. A lot of like hand use. You may also hear the term visual motor skills or visual motor integration. This is essentially another way to describe hand-eye coordination, essentially. It's the use of visual information from our environments to influence our motor movements in a task. You might also hear object manipulation skills referred to by an OT. That's just a fancy way to describe ball skills, catching, rolling, throwing, kicking. We'll do things like cognitive skills, sensory skills, social emotional skills. So basically, we work on all kinds of things to help support our clients in completing bigger tasks during their days. As occupational therapists, we break down tasks into individual skills in what's called an activity analysis. Your child's BCBA might do this too, but OTs do it from a slightly different perspective. We look at every piece of what a child must be able to do in order to complete an activity as a whole, including all internal and external factors which might impact their performance. From there, we take a look at what areas of performance specifically are coming easily to a child and which ones need some more attention or practice. That is what helps us to design and carry out our interventions and activities that we facilitate during our therapy sessions. We tend to do this in a pretty sneaky way where it might just feel like we're playing with a child, but we are very intentional about the toys we present and the activities we include in our sessions. So here I just did a kind of a quick sample activity analysis for you for a game of bingo. And if you think about it, bingo is a pretty straightforward game. You get your card, you wait for your number to be called. When you hear your number, you put your chip on the number, and when you get 5 in a row, you yell bingo. Pretty cut and dry. But there are so many component skills that allow you to successfully engage in that game of bingo. Things like physical skills, being able to move your arms to cross the middle of your body, to grasp those bingo chips in your hands and to sort of manipulate them and put them on the number that you want and not just dropping them on the card. Being able to say, okay, I have to put my chip on B3, let's find B3 and put it on B3. Things, cognitive skills like sustained attention and number and letter recognition. If I can't recognize the letter G, I might have a really hard time then finding the 52 that goes beneath it. Working on socially appropriate behavior and impulse control, not just yelling out bingo when you want to be done with the game, or swiping the chips off of your neighbor's card. Working through that can be pretty tricky sometimes, especially for some of our earlier learners. And sensory skills like auditory comprehension. So hearing the bingo caller call a number, then seeing it on your card, remembering it in your short-term memory that I'm looking for the number 15 right now, and then acting on that once you've located it on your card. There's also things like figure ground skills and visual checking. So looking at all those numbers on your card and finding a specific one, almost like a needle in a haystack. So long story short, there is a lot that goes into bingo, even though it seems pretty straightforward. So if I had a kiddo who's having a hard time with bingo, we could just play lots and lots of bingo, but that would get old really quick. And it could be really, really frustrating for my client, especially if they're having trouble with multiple factors that go into this game. So if I have a client who's having difficulty with visual scanning or finding objects in a busy background, we might work on an I Spy activity during OT to sharpen those skills. Or if they're having a hard time grasping the bingo chips and putting them where they want. We might play with a fine motor toy like a light bright or a marble run toy in order to build that grasp. If they're having a hard time sitting upright at the table, we could work on their core strength and stability by balancing on the wall or completing activities on the floor propped up on their elbows. We can work on these component skills that they're having trouble with in a totally different context that will still help them, so that the next time we go to play bingo, it might just get a little bit easier, one skill at a time. So I'm going to get into sensory skills here, which is a pretty big OT area we target. But before we dive in, oh my goodness, it gave you the answer already. There was supposed to be an animation. So pretend that there was an animation. Contrary to what you might have been taught in elementary school, there are actually 8 major sensory systems. A lot of times we'll teach kiddos that there's 5 basic ones, but there are 8 in total. And then the next slide, I'll explain the last 3 a little more. So you've got your visual system, you have your auditory system or hearing, you have your sense of smell or your olfactory system, you have your gustatory system, which is your sense of taste, you have your tactile system, which is your sort of basic sense of touch. And then you have your proprioceptive, vestibular, and interoceptive systems. So I will go into the next slide and explain what those are in a little more depth, because they're a little more abstract, but I work on these areas quite a bit with my kiddos. As I mentioned before, working with kids with autism often requires lots of sensory troubleshooting. In my personal experience, many of my kids that I work with experience challenges in these 3 areas, even if they don't have any profound challenges in other sensory areas. The vestibular system is responsible for sort of detecting and regulating the perception of motion and balance. This system organizes information from the eyes, the brain, and the inner ear, which is the epicenter for your body's sense of balance, fun fact. And it helps to communicate how to keep your body upright and safe. When you experience vertigo, that is a symptom of your body's vestibular system being dysregulated. Then we have our proprioceptive system, and that helps the body to determine where it is in space and to organize the sensory input we get from the environment. It helps us to be aware of our bodies and how to use and position them effectively and safely. This information largely comes from receptors in the skin, which then send signals to be interpreted by the brain. So you might see a child showing difficulty with proprioception if they're clumsy and fall a lot while they're running and playing, if they have abnormal posture and kind of hold themselves in a sort of abnormal way, or if they show a lot of restlessness during their activities and they're just itching to go, go, go. Interoception is that last one. It's a little more challenging to conceptualize when you're explaining it to a child, but it's essentially the collection of sensations that we feel within our own bodies. So sensations like pain, nausea, hunger, having a full bladder, those are all interoceptive sensations, and they are uniquely personal. I have no idea what it feels like for someone else to be hungry. All I know is how it feels within my own body. This internal sense of understanding one's own body has a huge influence on our ability to self-regulate, to connect with others, and to maintain our own mental health. So we work on lots of this sensory stuff with our kiddos. Occupational therapists are often considered to be sensory experts. So while engaging in all of these other daily occupations and targeting all of these skills, we have to consider the influence that our sensory systems have on the way that we perceive and engage with the world, and then how those perceptions influence our skills and behaviors. Our sensory systems help us receive information from the environment, interpret it in our brains, and then generate a response to it. In children with autism, sensory processing is often affected and can have a big impact on how their child engages with their world. As OTs, our job is to help make sense of our kiddos' sensory needs and then take those needs into consideration when designing interventions and strategies for them. So for example, if a child is highly reactive to sound, I might help them tolerate and utilize headphones during their day to filter out some extraneous noises. or helping a child who's seeking a lot of movement to sort of organize their thoughts by either maybe providing them with a yoga ball chair so they can kind of move and bounce around while they're seated, or giving them some like deep pressure in order to calm and regulate them. Even something as simple as having a child swing on a swing for a little while can be very regulating for them if they're having a hard time organizing their bodies and the information they're getting from the world. So for that, I'll refer to this picture that is in this slide. This is actually one of my kiddos that I work with in OT. He is using a variety of sensory strategies in this picture. He is in a therapy swing. And he's also wearing a body sock, which if you've never used one of those, it's essentially like a big sort of neoprene sleeping bag that provides him really gentle but deep pressure, almost like the sensation of getting a deep hug. So he put that on himself. He will go right to town and get right in it. So he did that while he's in the swing. And then not pictured in, but in the picture, but under the body sock, he is using a Z-Vibe oral tool, which is essentially almost like an electric toothbrush, but instead of a toothbrush head, it has a little like sort of silicone chewy piece. So a child can chew on that and use that to get some sensory stimulation in their mouths, especially if they're into biting or chewing on things or putting their fingers in their mouth. While he's using that, he was also using a fidget toy, one of the little pop-it toys with the bubbles on it, sort of fidgeting in there. So you would think maybe this is a lot going on, but if you knew this kiddo, he is a wild man. And immediately after this picture was taken, we went and sat at the table and did some of the most productive tracing and coloring work that we've ever done. So it can really be helpful for a kiddo if you kind of give them the outlets that they're needing for their sensory systems. Most occupational therapists can provide a basic level of sensory intervention with their clients. In order to provide more in-depth sensory integration interventions, it does require some extensive additional training and certification. There are some OTs who just spend their entire careers just working on sensory integration strategies for their clients. But as a generalist, sensory skills are just one piece of the big mosaic that makes up our kiddos and what we address. If you want to learn some more about sensory systems and how to support your child with sensory activities at home, I highly encourage you to come back in August to hear our full sensory skill webinar hosted by my incredible colleagues, Maddie and Molly. At the end of this presentation, there's a slide that has all those dates too, so don't stress about writing these down. We'll come back to it for sure. So one of the big areas that parents often come to me with concerns about is their child's handwriting skills. In public schools, handwriting often gets pushed earlier and earlier in classrooms due to changes in curriculum. The truth of the matter is that children don't typically have a mature grasp on their writing utensils when writing until at least 4 years old, but more often between the ages of 5 or 6. And so it's not super realistic to expect that children will have impeccable handwriting at the preschool or kindergarten level, even though curriculums have started to shift that way. Children sometimes don't even have an established hand dominance until the ages of 4 to 6. All these things are important to consider. So if your child is 3 and they aren't writing the full alphabet with a pencil yet, don't sweat it. But there are some things that we as OTs and that you guys can do at home to help prepare your kiddos to be successful early writers. We call these pre-writing skills. So this is basically laying the foundation to create a strong writer when they are developmentally ready. This can include letter identification, getting your hand strengthening and fine motor coordination going with some of those, like I mentioned, like a light bright or other sort of little fine motor toys. Finger isolation, which is using your fingers separately from each other rather than as like a collective unit, like a claw. Aiming and scribbling, tracing lines and shapes, and making letters out of Play-Doh, tracing them in sand. Sort of all of these activities can help strengthen your child's writing skills before they even pick up a pencil and paper. So you can, at home, you could have your child paint or color on a vertical surface like an easel or taping a big piece of paper to a wall. This will help them to get some wrist extension going on and to hold their wrists back a little bit. That will help them to develop muscles in their hands and wrists in order to hold that pencil in a correct, mature position once they're ready. Also, things like giving them smaller, shorter writing utensils can help encourage that fingertip grasp. I have so many kiddos I work with who are dead set on using that palm or supinate, that fisted grasp right there, that 12 to 15 month milestone. And it is amazing that once I swap out that larger marker for a shorter one, or the second that I snap that crayon in half, it's amazing to see how many kids will naturally switch to a fingertip grasp to hold it. They don't always like it right away. That is a different story. I've definitely contended with that quite a bit in my OT sessions, but we work through it, and it's helpful for them because it does get them used to getting a more mature grasp. Another shameless plug, if you are interested in learning more about fine motor skills, there is a webinar in December devoted entirely to fine motor skills, hosted by my brilliant colleague, Callie. So she'll talk a lot more about some specifics that you can do at home, as well as more of the sort of complex idea of fine motor skills themselves. The next topic I'll touch on today is feeding. Feeding is another big area that OTs work on at Bierman. Mealtimes are tricky, and they're actually really complicated and can get really overwhelming for our kiddos with autism. When talking about feeding skills, there's a lot to consider there. For starters, utensil use is a big one. So when eating with a spoon or a fork, a child has to be able to grasp and then manipulate that spoon or fork in their hands, load it with food, stabilize it and keep it from dumping out, and bring it to their mouth without losing their entire bite. That's a lot. We work on building up those fine motor and visual motor skills to make this easier. And we'll work on using adaptive equipment like using forks or spoons with a bigger, thicker handle, or maybe like a bowl with a suction cup on the bottom to help in their food from sliding out from under them. Things like that will help make the task easier as needed. And we're constantly reevaluating and addressing if we still need that equipment, if we need more equipment, changing how we're setting things up, etc. We also have to consider the oral motor skills needed in order to safely hold and chew that food in your mouth once it gets there. We also work on oral motor skills needed for like drinking from a straw or from an open cup. That's something we address quite a bit in Bierman. In OT, we can work on exercises and activities to strengthen the tongue and the facial muscles in order to help with this. We also, with talking about oral motor skills, we can also consider the sensory aspects of feeding, which I'll dive into a little more in the next slides. But however, as it pertains to oral motor skills, or sort of moving your mouth around, in children with autism, it's not super uncommon to see overstuffing or packing their mouths with food. A lot of times this can be related to sensory hyporesponsivity, basically needing a lot more input in order to gain awareness of things happening in and around their mouths. OTs can help children build awareness of that sensory information they're receiving while eating. We can help them practice taking smaller bites of food while still getting that sensory input in different, safer ways. So one tool I might use, like that Z-Vibe oral tool I mentioned before with my kiddo on the swing, that might be something that I use if I have a kiddo who is packing full of food, just to build some more awareness and blood flow to the oral area, and prevent packing, which can become very unsafe very quickly. OTs also are very big on seating and making sure kids are in the optimal position during a task, not just during feeding, during all kinds of activities, but especially during feeding to help promote their safety. If a child has adequate support during a task, we can ensure that their bodies are prepared to take on this big, complicated task of being presented with food, getting it from their plate to their mouth to their bellies. We as OTs like to implement what's called the 90-90-90 rule. This means that a child who is in the optimal sitting position will have their hips, their knees, and their ankles all at 90-degree angles, similar to this little boy in this picture. This will help a child's body to know where it is in space, that proprioceptive piece. and will assist them in organizing all the sensory information that is coming at them rapid fire during a meal. So being in a safe, stable position is one less thing that their little bodies have to decode and interpret during this big, vast mealtime process. Then there's the granddaddy of them all, food toleration. It can be super tricky with our kids with autism to tolerate new foods being presented to them, let alone eating them. In OT, we can work on introduction to new or non-preferred foods in a variety of ways. We do a lot of food play and food interaction in order to get our clients comfortable around new foods in general without any real expectation for them to actually eat it. What this does is it helps to build a healthy relationship between the child and food as they start to build their feeding skills. We will often use a step-by-step introduction to new foods and non-preferred foods, which is illustrated in this pretty complicated graphic, or it looks pretty complicated, but if you look at it, there's a lot of steps that actually go between a food being presented to a child and then working all the way up to actually eating it. So in our OT sessions, we'll often work on building up a child's toleration for novel foods step by step by step, gradually shaping their engagement with a novel food from simply being presented with a new food in the same space as them, all the way up to actually eating it. And while everyone, of course, has their own preferences and foods they don't like, this gradual food interaction strategy can be a great way to systematically expose those extremely picky new eaters to new foods. Actually, today, as a matter of fact, there's a child that I have worked with. He was my first kiddo I started with at Bierman. When I first started with him, he would not even tolerate being in the same room as his mother while she was eating food. He would kick her out. And today, during my OT session, he fed himself some strawberry banana puree off of a spoon and was using that throughout the session, and I didn't even have to prompt him to do it. So it was pretty cool. It's been a long, long road to get there, but we eventually went from not even tolerating being in the same room as food to then independently engaging with it, which was pretty awesome. Here we go. We also use a strategy called food chaining with some of our clients, which is where we gradually work from a highly preferred food to a new food by presenting other foods with similar attributes to those foods that they already know and like. So for example, if we have a child who loves fruit gummies, we might then naturally introduce them to maybe just strawberry gummies, to then a strawberry fruit roll-up. Then we might go to maybe strawberry fruit leather, and then we might venture into maybe freeze-dried strawberries, and then make that venture into sliced fresh strawberries. Though for some kids, this food chain might not even be that straightforward. We might even be working on presenting a different brand of fruit roll-up, or presenting it cut into pieces rather than as a large strip. By making these teeny tiny changes to foods that our kids already know and like, we can help them build their food repertoire and their toleration of these new foods in a more comfortable way. If you're interested in learning more about feeding, it is a very complex topic. There's a lot that goes into it, but there's going to be another OT presentation specifically about feeding strategies on October 3rd, hosted by my lovely colleague, Maggie. So if that's something you're interested in learning more about, I highly encourage you to tune in. I could spend all night talking about feeding and we would not even scratch the surface. Something else that gets commonly addressed in OT at Bierman is dressing skills. Many of our kiddos struggle with dressing for a variety of reasons. Some children have a hard time with the fine motor coordination or the hand-eye coordination to manipulate the buttons and the zippers. Sometimes they struggle with the texture of the fabric or the sensation of pulling a shirt over their heads. I have a few kiddos with that right now that we're working through. Some kids just cannot figure out the difference between the back and the front of a shirt, no matter how many times you practice it, let alone how to orient it to get their bodies into it. Another challenge you might not necessarily think of as a barrier to dressing skills is a child's gross motor coordination. So for example, if a child has a hard time standing on one foot, just standing there, they may also have a hard time with shifting weight between their legs to put their pants on. Or if a child has poor core strength, they may have a really hard time bending and reaching and twisting in order to get their bodies into their clothes in any way, shape, or form that's efficient or timely. In OT, we work on things like managing clothing fasteners like buttons and zippers, snaps and laces. We also work on putting on and taking off clothing, adjusting clothing once it's on, choosing appropriate clothing for the weather, even things like socks and shoes. We can work on those component skills like core strength and hand-eye coordination in order to make dressing and other tasks easier down the road. We work on breaking down these bigger, more daunting tasks into smaller chunks so that our kiddos can gain confidence in their skills step by step. So some fun little OT pro tips you can try at home. I sometimes will set children up with those big retro scrunchies, and I'll have them practice taking them on and off their feet and as a way to practice sock skills without having to contend with the entire rest of the sock. We can just work on getting their foot in the hole. Something else I've done before is you can take an old pair of tights or leggings and just leave the waistband in order to have them practice pulling on a pair of pants or taking them off. Also getting something like a Build-A-Bear or a baby doll, or even this little dressing bear that I put in the presentation can help them practice things like clothing orientation, managing their clothes, figuring out where the back is, where the front is, and managing those buttons and zippers without just putting a shirt on and off a million times. Other times I'll also give a child a shirt with like a bright graphic on the front, but only on the front, or putting stickers on a shirt as some visual markers to help them figure out how to dress themselves with less assistance. So dressing is pretty complicated too. Takes a lot of time, takes a lot of practice, but we work on it quite a bit in OT at Bierman. I'm going to go off on a bit of a tangent here, but it is an important one. This right here is one of my absolute favorite quotes. When you cut it for me, write it for me, open it for me, set it up for me, draw it for me, or find it for me, all I learn is that you do it better than me. How many times have you been getting yourself or your child ready in the morning and say, just get over here, just let me do it for you. We don't have time for this. While I absolutely understand the rush and the madness in the mornings and how tough it can be to watch a child struggle through a tricky task where it might otherwise just take 5 seconds if you just did it for them, it is critical that we provide children the opportunity to practice those skills that they are observing from you and are beginning to learn for themselves. We sometimes see our kiddos fall into a pattern that we call learned helplessness, which effectively means that if I just take long enough or whine loud enough or pout big enough, or if I just don't do it at all, mom or dad or another grown-up is just going to step in and do it for me. This can be a problem across the board, but I feel like I personally see a lot of this learned helplessness in those self-care skill areas like feeding and dressing. Giving children a safe space to practice what they're learning can make a really big difference in teaching them how to be increasingly independent little people. It can be very hard and it can be a time-consuming process. I have to stop myself from helping my kids time and time again, knowing that they're learning, but it is so worth it in the end. And I promise it does not make you a bad parent. There is a balance between providing a child with enough support to be successful and enough freedom to struggle a little bit and build that independence. In occupational therapy terms, we call this the just right challenge. Providing a child with opportunities to learn in these gradual steps as they are ready for them is the best way to build long-lasting learning and independence with new skills. For this, it is all about balance. We, of course, don't want them to get frustrated or discouraged to the point where they just don't want to do it at all, but we also don't want them to fall into this learned helplessness pattern. So being in tune with your child's needs and personality is incredibly important for figuring out when to gently push them and when to back off and to support them a little more. So something really unique about my role as an occupational therapist at Bierman is my ability to collaborate with BCBAs on a daily basis. We are constantly joining together to determine the best way to teach our clients so that they can be successful. OT and ABA do have some similarities when it comes to analyzing a skill or a task that a child's engaging in. We analyze each component of those tasks and help to determine together where those challenges are. so we can better support our clients to overcome them. When I collaborate with the BCBA, I bring my specialized knowledge of developmental milestones and sequences, adaptive equipment, motor skill development, maybe some activities that I've done in the past to help address those skills. BCBAs also bring a very strong skill set with emphasis on behavior and really understanding the idea of why our clients do the things they do and how to support them in shaping those skills and behaviors in a way that is conducive to learning for those specific clients. Together, we determine what is developmentally and behaviorally appropriate for a child, and then help to develop their skills in ways that are meaningful and relevant, meeting our kids where they are and giving them the tools for success, whatever that is for them. In my opinion, the multifaceted approach to providing therapy is what's so special about Bierman. The BCBAs, the speech therapists, and occupational therapists are constantly teaching and learning from one another. My knowledge is constantly expanding based on what I'm learning from my colleagues, and that helps me to be a better therapist through and through. Our therapy team is able to bring a diverse skill set and background and work together to achieve the one common goal of helping our clients learn and grow. So I have just included a couple of areas where I might collaborate with a BCBA during my time at Bierman. We might work on positioning and seating, talking through those food preferences, talking through food expansion strategies that I'm finding helpful and how to work those into their daily routines beyond their OT sessions. Working on those sensory aspects of feeding that a BCBA might not be as well versed in, and helping to understand how to better support their clients sort of from a multifaceted perspective to really troubleshoot from all angles. Self-care skills, we might talk about developmental milestones, what's going right, what's not going so smoothly, and helping to build in programs, activities, and other sort of opportunities for our kiddos to learn and gain those component skills to help support their growth as they learn. So if you have a child who you feel would benefit from OT services, what's next? Your first step should be to understand what your insurance benefits for OT services are. It varies from insurance to insurance, so it's helpful to understand what your benefit looks like before you get started. Next, reach out to your pediatrician. If they feel as though OT is appropriate and would benefit your child, they will write a referral for evaluation and treatment that your OT will need to get started. From there, they can point you in the direction of trusted clinicians near you. I personally highly recommend reaching out to other parents to get their feedback on therapists that they and their kiddos have worked with. There are a lot of OTs who specialize in specific areas of treatment, like I mentioned before, like sensory integration. There are feeding specialists, adaptive equipment specialists. Oftentimes, a quick Google search followed up by a word of mouth recommendation is a really great way to find a clinician that will suit your needs. And if your child is already receiving services at Bierman and is not yet receiving OT services, allow me to shamelessly plug our Bierman OT team here. I must say that our occupational therapy team is the best of the best. I would highly recommend reaching out to your center's clinical director for more information if they're not enrolled already. I really do have some of the best, most brilliant colleagues I've ever met. So, and I'm not just saying that. We have an amazing team. Once you've connected with an occupational therapist, they will often request more information from you to find out more about those contexts that make your child who they are and how they've gotten to where they are today. Things like developmental milestones in infancy, what your family is like, what your routines are. From there, they'll complete an evaluation to determine where and how they can best support your child. They will develop goals based on all the information that they gather from you and their evaluation. Once all this is complete, they notify any involved insurances, make sure that treatment is authorized, and your child is good to go. I'd also like to add really quickly that if you've enjoyed this seminar and you'd like to learn more, or even if you didn't enjoy this seminar and want to see if my colleagues can do a better job, I'd love to invite you to check out our upcoming OT seminars. These seminars will be much more specific than the one I've just presented. So if you'd like to learn more about a specific topic, or if you have more specific questions about these topics, I highly recommend you check them out. Like I mentioned, my colleagues are brilliant. I learn from them every day. They have a lot of knowledge to share with you. So on August 1st, we're doing sensory skills. October 3rd, feeding. And December 5th is fine motor skills. So definitely keep your eyes on social media channels for those seminars to be announced if you want to learn some more. And last but not least, I would like to leave you with this quote by Benjamin Franklin that really sums up why I do what I do. Tell me and I forget. Teach me and I remember. Involve me and I learn. Experience is really the best teacher, and I am so thrilled by the fact that I get to support my kiddos in accessing new skills and experiences every single day. Occupational therapy is a vast, flexible, incredible field, and I am so very proud to be a part of it. And I'm glad that now you all know a little bit more about it too. Thank you all for your time this evening. I'm really glad you all joined us tonight.